This was a 9-year-old boy who came from Nigeria.
Okay.
And these were three brothers who went to their grandfather to celebrate Christmas. And there, they found a firearm in their cupboard, grandfather's firearm. Unfortunately,
This happened in Dubai, yeah?
It happened in Nigeria.
happened in Nigeria.
Firearm injuries don't happen
Okay.
here. So
Okay.
Thankfully,
Thankfully,
it's so regulated here. So
Correct.
So this was in Nigeria, and kids, they are just fiddling with things. They found this gun, they started pointing at each other, and it misfired. And this 9-year-old had an injury in his foot.
Okay.
So his mid part of the foot was almost missing, and they got
The bone was crushed.
the bone was gone. There was I would say a hole of almost 10 centimeters in the foot. So the front of the foot, the back of the foot was still attached, but with a small, tissue. Now they went to Abuja University Hospital, big hospitals wherever they could, and everybody said that it has to be amputated. There is no other way. There was no blood supply. There was very little survival in that foot. So they started sending inquiries to other countries, to India, to UAE, to US, and fortunately they were able to do it. So pictures came to us, and I said we can give it a try. But from a distance, it's very difficult to trust a doctor,
100%.
So they came, and they wanted consultation with a lot of doctors here. So they went to different hospitals, and they finally landed up with me. So I saw that for this child was very in extreme pain. So I just made him comfortable, and mom said that something happened here, that the child is comfortable, and I trust this doctor more than anybody else. Something happened. So we did a 14-hour surgery. We transferred tissue from his back to the foot. The foot survived.
Okay.
But it was still soft because there was no bone.
But do these tissues match?
Yeah.
Because it's a different part of a body.
Yes, but it's
And
your
you can
own body.
It's your own body.
So
okay.
it doesn't get rejected or anything.
Okay. So the DNA, everything matches.
Absolutely.
Okay.
So it's called a free tissue transfer. We did a transfer from his back to his foot, and it survived. But the main part which we did was 3D printing his missing bone by using 3D printing technology. And we printed a titanium bone.
And that's where Dubai stands out.
Absolutely. So
okay.
that's one reconstruction which we have done. He's now almost 15 years. And he plays football, he does sports.
What are you saying?
Yes, he runs, and you cannot tell that his foot has been operated. So that makes me really,
God. This is a
proud.
very unique story. And in fact, I'm sure the rest of his life, he must be literally thanking you for what he is today.
I'm thankful that, they trusted me. And I'm thankful to God that he, enabled this to happen.
But the experience also plays a very important role especially when it comes to accepting such cases.
Yes.
Because if you've never seen something of the past in your experience, or at least in your academic life, then it's become very difficult for you to even, get that confidence to whether I should accept this case or not.
Agreed.
And apart from that, the resources also play a very important role.
Yes.
Because in this case, I felt the resources played a very important role.
Yes. Fortunately, they were able to afford it. So 3D printing was done in Belgium. So there were designers working with us from US, from Mohammed bin Rashid University, Dubai.
Okay.
So this was a whole collaborative effort to design something and execute it in a way that it'll grow with the child or integrate with the child. Because this was titanium.
So as he grows,
bone grows into it.
Bone grows into it, yeah?
Yes. Because it
becomes
porous.
a natural, and it takes place in the natural form.
Instead of just being a solid block of metal, it was porous. Looking at the microanatomy of the bone, it was printed like that only.
Wow.
So that was good.
What will be the cost of these things? Because again, the affordability also matters,
Yes.
someone sitting in India earning in rupees and then expecting him to come and do an operation in Dubai, a surgery in Dubai in dirhams.
Yes.
It's 24 times more.
Absolutely. Now the implant alone, to give you an idea, the implant alone costed us almost around 30,000 dirhams.
Okay.
Which was medical grade titanium.
Roughly about 6.5 lakhs.
Yes. But if you look at it from the point of view of the patient. He's a child, right?
100%. Yeah. I mean, it cannot be compared with money, but yet
Absolutely.
I'm saying the affordability really matters at times.
100%.
Because especially when they are from Nigeria
I agree.
and maybe they couldn't afford it, or maybe if it's possible. I mean, and then whether insurance plays an important role in these part of surgeries. I mean, when industrial cases come to you, does insurance cover it?
So sometimes
under workman compensation.
Yeah, sometimes work-related injuries are covered. Sometimes these are not. Sometimes the company is helping. We also have tie-ups with charitable organizations. When nothing works, we sometimes ask for help. But insurance, yes,